Welcome back. Here we continue our exploration of sternoclavicular joint in the shoulder complex. And here we have with us today the sternoclavicular joint motions. Do you know how many degrees of freedom sternoclavicular joint? Of course, we learned this in the previous video. That is 3 degrees of freedom. 3 rotatory and 3 translatory degrees of freedom, and hence the movements in sternoclavicular joint are elevation, depression, protraction, retraction, and anterior and posterior rotation movements. So these are the 3 basic movements that are possible in the sternoclavicular joint. Let us examine each one of them in particular. To be frank, I thought to upload this videos in shoulder complex on alternate days, but many students are informed that they have examinations coming on July mid, so I thought that this would help you all. So we have regular updates in shoulder complex, and as I told you, the shoulder complex and sternoclavicular joint is having 3 degrees of freedom. How many degrees? 3 degrees of freedom, and hence the motions possible are elevation and depression, okay, the protraction and retraction, anterior and posterior rotation. So these are the 3 possible movements in the sternoclavicular joint. And these are the 3 rotatory movements. What are the translatory movements? We saw that it has 3 translatory movements also. The translatory movements includes, for example, if this is the clavicular end and this is the sternum, the clavicle can move upward, translate superior translation. It can translate inferiorly. So this is the superior translation. This is the inferior translation. It can move this side, translate a bit, that is the lateral translation. It can translate this side, that is a medial translation, and of course it can translate in the AP axis, anterior translation, and backward posterior translation. So the translatory motions that are possible in the sternoclavicular joint are 3 combinations, that is the superior and inferior translation, okay, lateral and medial translatory movement, and posterior and anterior translatory movement. These are very minimal movements happening in a slight degree, okay. The anterior and posterior, medial and lateral, superior and inferior. Our point of interest is understand the rotatory movements. So the first one is elevation and depression. Okay, first one is elevation and depression. What is elevation? This movement, this is the bilateral elevation of the clavicle, okay, the sternoclavicular joint. And why I want to give you some peculiar ideas, some important ideas, that it is difficult for us to observe this movement in the medial side of this joint, that is in the sternoclavicular joint. And this is a long lever too. Due to this, we take the lateral end of the clavicle, this is the lateral end of the clavicle, as the reference point. Take this to your mind, don't forget that. So throughout our discussion, the lateral end of the clavicle will be the reference point. That is, we are describing motion with respect to the lateral end. The movement is happening in the medial end, but the clavicle as such is moving, and this is a single lever. So we take the lateral end, which is more observable, as the reference point of the movement. So the lateral end is the reference point. And now what is elevation? Elevation is the movement of lateral end of the clavicle upwards. Elevation, the word itself is explanatory. No need to buy this. Elevation of the clavicle. So the lateral end of the clavicle elevates, or the lateral end of the clavicle moves upwards. That is known as the elevation. Am I right? Yes, that's so simple. And the lateral end of the clavicle moves downwards. That is the depression. So the elevation is lateral end of the clavicle moves upward, and depression is lateral end of the clavicle moves downward. Can you tell me which axis is this movement happening? The movement is happening in AP axis. Therefore, you are sure that if it is an AP axis movement, this would be a frontal plane. This is a frontal plane. If anybody is having doubts on axis and planes, we have a video in our channel on this exclusively. Kindly refer to that. So this is an AP axis movement and a frontal plane. So the lateral end of the clavicle is the reference point. Lateral end is the reference point. And elevation means lateral end moves upwards. Depression means lateral end moves downwards. Am I right? Yes. So that is a very simple discussion, but that's not the complete picture. We need to understand some more concept, like if you look into the clavicle, we see that the clavicle is actually having a saddle shaped articular surface. So this clavicle as well as this manubrium sternum is having articular surface as a saddle shape. That means if it is convex over here, it will be concave over here. That is reciprocally concave convex. This is concave over here, this would be convex over here. Okay. Now with this clavicle you can understand. For example, this clavicle is moving for elevation. This is the movement that is going to happen in elevation of the clavicle, and at this time you can see that here there is a very small saddle shape. Even though it is small, it is relevant when it comes to movement. Okay, very small convex and concave surfaces, okay, alternatively. So what is happening in the elevation is that this convex part of the clavicle, remember, convex part of the clavicle, this elevation, the convex part of the clavicle, that is the convex in clavicle, moves on concave on manubrium. Can you tell me the peculiarities of this motion? Definitely this motion is our convex concave rule. Here we have to apply it. That is, the convex clavicle is moving on the relatively stationary concave manubrium. That is convex on concave. So arthrokinematics, that is the intra-articular motions, inside the joint motions, will be opposite to the outside motion. So the outside motion is what? What is the outside motion? The outside motion here would be elevation. So the lateral end of the clavicle will move for elevation, whereas the medial joint surface or medial articular surface, what will happen to the medial articular surface? We can clearly observe here. This will roll superiorly. Am I right? So this is moving upwards. This also will roll upwards or superiorly. At the same time, this is convex moving on a concave. So this would glide inferiorly. The gliding will be inferior. So if this is the manubrium sternum notch, a very small notch in the manubrium, okay, this is the clavicle, it's a convex end is moving, so the lateral end will move upwards like this. Along with that, the arthrokinematics or intra-articular motion, first one, the rolling will be upwards, superior rolling, but at the same time, this will glide inferiorly. This will glide inferior. The gliding movement will be taking place inferiorly. So elevation of the clavicle is characterized by rolling of the clavicle superiorly with the lateral end of the clavicle and inferior glide of the medial and subarticular surface of the clavicle. So this you should remember. That means in elevation, rolls superiorly and glides inferiorly. Why? It is the convex concave rule, which says that when a convex is moving on concave, arthrokinematics and osteokinematics occur opposite to each other. If you have any doubts on arthrokinematics and osteokinematics, and if you wish to have a video on it, please let me know in the comment section. So we'll have a video on that at the earliest. And when it happens to the depression, this is the opposite. Depression means, what is happening in the depression? The depression means the clavicle lateral end is moving downwards. So this will roll downwards, whereas this will elevate or glide upwards. Clear? The gliding occurs superiorly, whereas rolling occurs inferiorly. So this is the motion. Exact opposite of elevation happens in depression. So in depression, this glides downwards, rolls downwards, whereas glides upwards like this. Okay, glides superiorly. So these are the movements that is happening in elevation. So elevation of the clavicle, we take the reference point as lateral end of the clavicle, epiaxis and frontal plane movement. Elevation is characterized by lateral end of the clavicle moving upwards. Depression is characterized by lateral end of the clavicle moving downwards. Am I right? Yes. And the arthrokinematics is in elevation, the clavicle lateral end and the medial articular surface rolls superiorly, whereas glides inferiorly. These movements are actually happening in the, not in the lateral end, this happens in the medial articular surface. That is why, because the medial clavicle is making the articulation, not the lateral end. We take the lateral end only for the reference point. This arthrokinematics do not occur in the lateral end but occurs in the medial end. The normal range of elevation is about 48 degree and depression is less than 50 degree. What is the normal range of elevation? 48 degree and depression is less than 15 degree. Now let us move on to the next motion, that is the protraction and retraction of the clavicle. What is that? The protraction and retraction of the clavicle. Everyone knows that movement, this movement. Protraction and retraction of the clavicle. So what is protraction and retraction? Here also you should remember which is the reference point throughout the discussion. The lateral end is the reference point. Lateral end of the clavicle is the reference point. Am I right? So this is a protraction and retraction. This is a vertical axis, y-axis movement. And this is what? A transverse plane movement. So it happens in the vertical axis and transverse plane. You can imagine that this is happening along with the ground. Anterior and posterior rotation. Protraction and retraction. Here anterior and posterior rotation. Usually rotations are happening along with the transverse plane. But what is the orientation of the clavicle? The clavicle is not vertical. The clavicle is a horizontal oriented bone. So that is the difference. So protraction and retraction is the movement that is happening in the vertical axis and transverse plane. Am I right? Yes. So how do you define protraction? Very simple. Protraction is defined as lateral end of the clavicle moves anteriorly. So simple. Retraction is the lateral end of the clavicle moves posteriorly. So that's so simple. But that's not the picture. We need to know the arthrokinematics. So in protraction, lateral end moves anteriorly. Lateral end moves anteriorly. Whereas in retraction, lateral end moves posteriorly. So when the lateral end is moving anteriorly, the earlier picture in elevation and depression was that convex mouths were moving on the concave. Remember, the clavicle is having two articular surfaces. One is a slightly convex and one is slightly concave. So in this protraction and retraction, what is happening is that the clavicle's concave is moving on convex on the manubrium. So that changes. That is, in protraction and retraction, concave clavicle moves on convex manubrium. Am I clear? So this is exact opposite. Here concave is moving on convex. So there is no problem. Osteo and arthrokinematics occurs in the same direction. That is, extra-articular and intra-articular motions occurs in the same direction. So what happens? Here the lateral end of the clavicle moves anteriorly. Lateral end of the clavicle moves anteriorly. At the same time, this one rolls anteriorly as well as glides anteriorly. Am I right? So that is so simple. That is because the concave is the moving part over there. Thus, so the lateral end of the clavicle moves anteriorly. The rolling happens anteriorly. At the same time, glide, not in the posterior direction, but glide also is, glide is also anteriorly. So the lateral end moves anterior. Rolling occurs anterior and gliding also occur anterior. So this is same direction movement in protraction. So what happens in retraction? Lateral end moves posterior, roll is posterior, whereas glide is also posterior. So that is easy to remember, right? Protraction and retraction is having same type of movement in arthro and osteokinematics. Am I right? Is it clear? Am I confusing you? I think no. This is a very simple discussion. If you are not thorough with concave, convex, rotatory, there should be some confusion. If you are not thorough, kindly let me know, or at least refer from the textbook and learn that concept. And now we move on to what is the normal range of protraction and retraction. What is the normal range? Protraction, it is about 15 to 20 degree, whereas retraction is more than protraction, that is approximately 30 degree. So the protraction is 15 to 20 degree, whereas retraction is a 30 degree. So this is the bilateral protraction and retraction, unilateral protraction and retraction, elevation, depression. Am I right? Okay, so let us move on to the last movement in the sternoclavicular joint, that is the anterior and posterior rotation. Anterior and posterior rotation. This rotation is a bit confusing, but I will try my level best to make it easy for you. That is, the only difference is that if we are taking humerus rotation, this is the rotation of the humerus. Medial and lateral rotation of the hand is the rotation of the humerus. Because humerus is a longitudinal bone, but your clavicle is a horizontal one, am I right? So the clavicle is horizontal. So the longitudinal axis of this clavicle will not be this one, but it will be passing through the bone like this. So this will be the longitudinal axis of the bone. So the rotation of the clavicle happens with the longitudinal axis. Rotation usually happens with the longitudinal axis. So here it is a spinning movement. So rotation is the spinning movement. You can imagine that rotation is a spinning movement, not glide or in rolling, but it is a spinning movement with clavicle, manubrium plus disc. These three structures are involved. What are the structures? The clavicle, manubrium and the disc is involved in this rotation. The axis of this rotation, I told you now, is the longitudinal axis. Longitudinal axis of clavicle. The longitudinal axis of the clavicle is this one, not this movement. This is not the longitudinal axis. The longitudinal axis is the passing through the bone. So clavicle is a horizontal bone, so that will be the longitudinal axis. Now you need to listen carefully. Every bone can rotate in either direction. Humerus can rotate medially, laterally. Femur can rotate medial and lateral. But this clavicle is not having that skill. The clavicle can rotate more in the posterior direction, more than the anterior direction. So the clavicle is capable or skilled to move more in the posterior direction than in the anterior direction. Or you can even tell that anterior rotation is very, very, very minimal compared to the posterior. So what is the posterior rotation? So this is the clavicle, right? And this is its longitudinal axis also. So rotation should be a spinning movement around the longitudinal axis. This and this should be the rotation. So if you see this clavicle like this clavicle can rotate posteriorly like this. So this is the posterior rotation of the clavicle. What is that? When the clavicle is here, when the clavicle is rotating like this is the posterior rotation of the clavicle. Am I right? So this is the posterior rotation. What is happening in this posterior rotation? The inferior surface of the clavicle, this is the inferior surface, is actually coming anteriorly. Or the inferior surface is coming upwards. Inferior surface is coming upwards. So more clearly we can call this one as the upward rotation of the clavicle, or inferior surface is the moving one, so downward rotation of the clavicle. So it is more correct to call clavicular posterior rotation as upward rotation or downward rotation. Upward rotation means the inferior aspect of the clavicle is coming upwards. Okay, inferior aspect is coming out. So this clavicle has rotated. You can see this one. This clavicle has rotated and it has reached a particular position. This is the rotation. Posterior rotation or upward rotation or downward rotation. Am I right? Yes. So now from this posteriorly rotated position, clavicle moves anteriorly, rotate anteriorly. That is the anterior rotation of the clavicle. So anterior rotation of the clavicle is not this one, not this movement, but it is the rotation from, it is posteriorly rotated, rotation from posterior to anterior. Rotation from posterior rotated position to the neutral position is known as anterior rotation. Am I clear? Is the posterior rotated position to the neutral position. So your clavicle is now in the neutral position. This one can rotate posteriorly like this. So the inferior surface comes outwards. So this is called downward rotation or upward rotation. So this is the normal position. This is the posteriorly rotated position of the clavicle. Now your clavicle can return back to the normal. That is the anterior rotation. And after that neutral position, it may slightly rotate at 10 degree. That is the only anterior rotation possible. So anterior rotation of the clavicle, make sure that it is the rotation of the clavicle from posteriorly rotated position to the anterior, or posterior rotated position to the neutral. And it can have a degree of 10 degree past the neutral. It can have a degree of 10 degree past the neutral, whereas posterior rotation is 50 degrees. See the difference? So the posterior rotation of the clavicle can be around 50 degrees, whereas anterior rotation is only 10 degrees. Am I clear? Should I explain it once more? So the posterior rotation of the clavicle is happening in the longitudinal axis of the clavicle. Clavicle is a horizontal bone. This is the neutral position of the clavicle. Posterior rotation is a spinning movement. So posterior rotation means from that neutral position, clavicle rotates posteriorly. Since the inferior surface is coming upwards, we call it as upward rotation. Since this anterior surface, this upper surface or superior surface is moving downwards, we call it as downward rotation. So posterior rotation is equivalent to be called as upward or downward rotation. Don't confuse with that. That is just a naming, just a name. You don't have to remember that, or you don't have to get confused with that. What we need is the motion. So the motion here is that clavicle cannot rotate anteriorly. Clavicle has predominant rotation posteriorly. Cannot rotate, we cannot tell. Can rotate, but a slight degree anteriorly. So the major rotation is posteriorly. So posterior rotation means from the neutral position, clavicle is moving posterior and it is about 50 degree. Whereas anterior rotation is return from this posterior rotation to the neutral. So that is non degrees is to be the, because that is a posterior rotated position. From that clavicle should come to the neutral. After the neutral, it can pass the neutral by 10 degree, very slight 10 degree. That is the anterior rotation of the clavicle. So the posterior rotation of the clavicle is about 50 degree, whereas anterior rotation of the clavicle is about 10 degree. Yes, that's all about the sternoclavicular joint motions, elevation, depression, protraction, retraction, and medial and lateral rotation. And what about the sternoclavicular joint stability and stress? You know that sternoclavicular joint is an incongruent joint. Am I right? Yes, it's an incongruent joint. But we see that the degenerative changes in the sternoclavicular joint is very less. Why? It's incongruent, but then it should be degenerated. What is the reason for that? That is because you have two structures which are highly efficient in the sternoclavicular joint. That is your sternoclavicular joint disc, which we studied, and costoclavicular ligament. What is the main function of this? Force dissipation. So this will dissipate the compressive force. Your sternoclavicular disc and your, which one? Costoclavicular ligament, the strongest ligament, not the sternoclavicular, not the interclavicular, but costoclavicular ligament is going to dissipate the necessary unnecessary forces of muscle action and from the external surfaces, external sources. So this force dissipation will enable less degenerative changes in the sternoclavicular joint. So sternoclavicular joint degenerations is very less. Of course, dislocation is also less, at approximately about 1% of total dislocation in the body. Only there is the chance of sternoclavicular joint dislocation. But when we are taking the shoulder complex or shoulder gradient, about 3% of the dislocation can happen in the sternoclavicular joint. And finally, the subluxation is more common and more frequent than dislocation in the sternoclavicular. And that's all because of this strong costoclavicular ligament and the sternoclavicular joint disc. That's the greatest importance of this disc and the costoclavicular ligament. This makes even though the incongruent joint a strong and a congruent one. With this, we wind up this session. And if you like the video, please don't forget to click the like button and kindly subscribe to my channel. Do follow in the Instagram and Facebook profile, Tony's tutorial, or Facebook page. And if you have any doubts or if you need any notes, the notes are available free of cost. You can just contact me and I will just deliver you the notes. And next video we'll see the acromioclavicular joint. And until then, stay tuned. Thank you.